A pleasant good day to everyone. I am Dr. Ivy RESIDE, the Medical Center Chief of Quirino Memorial Medical Center, and I am pleased and honored to be speaking in your program as part of our worldwide celebration of World Pharmacy and Pharmacists Day 2022. I am not a pharmacist. Although I have several physician colleagues with backgrounds in pharmacy as a first course, and for sure I had some exposure during medical school. And so, pardon me if and when I say that for many reasons, many years ago, I was simply like the regular one and wana who believed that pharmacists were simply in pharmacies. For me and Juan and Juana, the pharmacist was the person behind the pharmacy counter, to whom we handed over our prescription and from whom we took our medicines and our change in return. Most people fail to realize and appreciate that the actual real pharmacist is very different from the person behind the counter. In fact, the pharmacist is so much more than what any Juan and Juana can imagine. Many years ago, true, the role of the pharmacist was basically confined to the pharmacy, and patient contact was mainly established over the counter. Dispensing was the duty of the day, and the pharmacist's responsibility to the patient ended when the dispensing was done. However, latest trends demonstrate that the role of the pharmacist has advanced and grown even outside the pharmacy walls, to include patient rooms, wards, intensive care units, ambulatory care, emergency room, and even the realm of research and public health. So indeed, it is time. It is time to change the mindset of Juan and Juana, to let them know that aside from doctors and nurses, pharmacists are crucial members of the healthcare team, and in some geographically isolated areas, may be the only healthcare professional available in the community. To further illustrate the changing landscape and role of the pharmacist in society, I present this slide. Our United Nations Sustainable Development Goals, or SDGs, which all UN member nations commit to contributing to achieving by the year 2030. Such ambitious goals. But worldwide, together, we can take small and large steps towards their realization. As part of the health workforce, it is obvious that pharmacists are directly involved in contributing to SDG number 3, good health and well-being. Pharmacists work wherever there are patients, in infirmaries, health posts, and hospitals, providing expertise as clinical and specialty pharmacists, educators, counselors, trainers, and many others. But on the ground, we also understand that pharmacists may also be called to lead committees, programs, and do other administrative work. And so with eyes open to the intricacies of hospital operations, health systems, political nuances, community setups, and networks, pharmacists are now armed with the necessary perspective to pursue research into drug development and health systems improvement. Since the Universal Healthcare Law was passed, we have often heard of the UHC, what it entails, what changes are to be expected, its noble goal of decreasing inequalities between the rich and poor, and preventing financial difficulties due to health-related expenditures. Our pharmacists will indeed take a vital role in the realization of universal health care. Our pharmacists will be at the forefront of developing our grassroots pharmacies or Butika ng Bayan, Level 1, 2, and LGU hospital pharmacies as they struggle with the leveling up of overall hospital services as well. They will engage not only patients and families for education and counseling, but communities as well, as our government also pushes for the enhanced reach of the OTS services and HIV/AIDS treatment hubs. And as we all make efforts to close the chapter on the COVID-19 pandemic, pharmacists will be called upon to heighten participation in vaccination programs nationwide. And as pharmacists continue to take a crucial role as partners in healthcare, they will take lead roles in antimicrobial stewardship initiatives, thus preventing drug resistance, and in the pharmaceutical industry as partners in drug development in line with SDG number 12. So yes, pharmacists can indeed do and be more. Enough of the typical mindset that places the pharmacist behind the counter of the drugstore and nothing more. The new generation pharmacists are now called to action to take on more challenging roles in healthcare. As members of the healthcare team, as patient partner, as teacher, educator, and health advocate, and of course, in support of universal healthcare and the development of apex and referral hospitals, pharmacists will need to step up and keep up. We are mandated to develop brain centers, cancer centers, trauma centers, geriatric centers, and these will all need capable and strong pharmacists who will ensure safe patient care. The challenge has been delivered and is now waiting for an answer. Thank you very much, and I wish you all the success as we navigate universal healthcare together. Maraming salamat po.